This is going to be a ball bridge variation. I do have some patients that get a lot of knee pain when their knees are bent or when they try to do the hamstring curl. So I always want to start in a position that's less painful on the knee. So if I lie down on my back and I'm using this ball, if I go to do this bridge with my knees bent, and some of my patients say that hurts in the front of their knees, I want to pick the position that's least painful. So I'll maybe start off with my knees a little bit more extended. Now if that's still painful, I may go all the way out to straight legs. And typically the straight leg is going to be less pressure or pain on the knee. So I'll start off trying to make sure I get hands at my sides. With my legs out straight, there's a little bit more of a tendency for my back to arch up off the ground. So I do want to make sure I begin this with my back flat into the ground, pulling my ribs down, and creating a fair amount of tension in my stomach. And with my legs out straight, I'm not going to lift very high. Because if I go too high, I'm going to start to create that sway in my back that I really don't want. So with the legs straight, I really want to focus on my toes, staying straight up towards the ceiling. I flatten my lower back into the floor, and I press, a little bit of a squeeze into the back of my hip. And I may start off with this, just to hold and back down, right? Now if this is going well and I want to start to work someone into the knee bend, I may have them come up and then just see how they feel and do a little small pulses. So in a short range, seeing if they can feel their hamstring, feel the back of their thigh with any significant knee pain. And I would probably do this more for time. Since it's such a small movement, I don't really like to make them count. So just more of a light endurance activity. The goal would be, can you stay in a range where you feel the back of your thigh, maybe even back of your calf, anything that feels like muscle working, but not pain or pressure in the front of the knee. And then obviously, as you get more comfortable, you can expand this into a little bit of a larger knee bend, making sure that you stay short of pain. But that straight leg position is a great one to start in, where you're going to have less likelihood of having pain in the knee.